about a very interesting appendix, that is the second appendix in the GTG 31, which is the guidelines for the management of fetal growth restriction, which was published in the year 2024. So this is a very recent update in the guidelines for fetal growth restriction. Now this guideline has an appendix, the second appendix 2, which has a lot of information together, but fortunately we have to remember it all. So I've tried to make a mnemonic so that we can individually remember the important risk factors and then understand how to apply these risk factors in the management of patients with fetal growth restriction. So if you go into the new category, it is now classifying the risk factors as no, moderate and high risk. No more into major, minor. It is now no risk, moderate risk and high risk. Now in this lecture, we're going to talk about the high risk factors. Now this is a story about a lady who has a very poor traumatic history, or the memory of her last pregnancy is something that she's not very happy about. Why? Because she has a history of a child which had fetal growth restriction. So there is history of previous fetal growth restriction. So she's definitely not happy and she's apprehensive that maybe there is recurrence. So this history, this memory, this sad past that she has is a very important high risk factor for recurrence. In this, like we know, history repeats itself, so she becomes high risk for having fetal growth restriction even in this pregnancy. She also has another traumatic history where she lost a baby. There was small for gestational age baby that was stillborn. So that is again not something she is very happy about, and she is upset about her previous traumas. Another trauma that she has is that she had to go and visit the doctor a lot of times because she had hypertension. So every time they used to pump in and measure her blood pressure, so she's not happy with that history also. And the previous pregnancy, there was history of hypertensive disease. So these are the things which have traumatized her and added to the risk factors which can lead to fetal growth restriction even in this pregnancy. Now, this is just about her last obstetric history. She also has some medical conditions because of which she is a little concerned that maybe she will have a fetal growth restriction even in this pregnancy. Now, what are those medical conditions which she is worried about? Now, this BP cuff kind of is stuck to her life. Even in her medical condition, she's got hypertension. So she's not able to get rid of the BP cuff. So she tells the doctor, "Oh, doctor, I have hypertension." And two very sound alike conditions, that is CCD and CKD, that is complex cardiac disease or chronic kidney disease. If these are two conditions that she has, then definitely it predisposes her to have a fetal growth restriction even in this pregnancy. So these two are individually high risk factors. Another important history that she wants to give to the doctor is that she's got apples and she's a big fan of Bruce Lee. I mean, this is the best mnemonic I could think of to remember the autoimmune diseases, that is antiphospholipid syndrome and systemic lupus erythematosus. So SLE and apples, that is antiphospholipid syndrome, autoimmune diseases, these are again high risk factors for fetal growth restriction. So we are done with her past obstetric history, we are done with her medical history. Now we come to her current pregnancy. Now, current pregnancy, there can be a lot of issues with the mother or with the baby. First, we'll talk about the mother. if she has significant bleeding during this pregnancy, then it's a major risk factor for fetal growth restriction. If the baby has echogenic bowel, you can see the echogenic bowel, or if the baby's estimated fetal weight is less than the 10th centile. We know if the weight is going, it has a trend of decrease. Anytime it will go below the 3rd centile. So 10th centile is a warning high risk sign for fetal growth restriction in the current pregnancy. And the small little lonely umbilical artery over here, that is a single umbilical artery. Of course, it's lonely, so it will show its presence, and that is, it will express itself as fetal growth restriction. So, again, single umbilical artery is a major, that is a high risk factor for fetal growth restriction. Now, few blood markers for fetal growth restriction in the current pregnancy. The easiest way I could summarize it off is Papa had very poor scores, that is, he had scored less than 5th centile. So mom put him to work and he was made to do the menial jobs. That is, he had to put the proteins, that is more than 2 proteins, took a lot of them actually, so more than 2 proteins, and they had to be thrown in more than 2 bins. So mom puts Papa to work where he has to throw more than 2 proteins into more than 2 bins, because he had scored less than 5th centile. Now that implies PAP A value less than 5th centile, inhibin A more than 2 mom, and alpha fetoprotein more than 2 mom. These three values are again high risk factors for fetal growth restriction. So this is the easiest way I could figure out to remember the high risk factors for fetal growth restriction. So we have to remember these because the management of the patient, be it clinics or in questions, depends on identifying the major risk factors and then managing accordingly. We will discuss the management in the next video. Till then, we have to get the factors on our grip. So let's remember it this way. Thank you.